Okay. All right, so please rise to salute the flag. United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So good evening and welcome to the January meeting of the Revere Board of Health. My name is Drew Bunker, Chair of the Revere Board of Health. Joining me for tonight's meetings are Board Member Dr. Greg Costanza and Board Member Neza Luandi. I tried. Also in attendance for tonight's meeting are City of Revere staff Lauren Buck, Director of Public Health, Michael Wells, Director of Municipal Inspections, Health Agent, and Paula Sepulveda, Administrative Assistant. So tonight's agenda, we're going to be discussing the topics of COVID-19. Lauren, you're going to give some updates, or yeah.
Okay, do we want to review and approve the minutes from December?
Yes, we do.
You all have the minutes in front of you. Do we approve of them?
That's what I was planning on saying. Where are the minutes? Maybe. This one? Okay. So I think are we talking about the regulations for chicken keeping?
We are not.
Okay.
Hopefully next week. I mean next month.
Okay. We're talking about finalizing and signing the regulations for the keeping of bees?
So we did that last
Yep.
last week. And
Okay.
then last month.
So I'm not sure what else we.
So I think basically you just have to say we approve the meeting minutes.
Oh, we approved the meeting minutes.
Okay. All right.
Thank you. Sorry.
Okay. So now
First
we're gonna, no, yeah, that's okay. So we're gonna move on to the monthly report. I'm not gonna kind of hang on this too much. One thing I just want to point out to all the board members is we have seen a significant increase in influenza cases. Our youngest was 3 months old and our oldest was 91 years old. So just keep in mind that, this time of year, obviously we expect to see an increase of influenza cases. There are 54 confirmed from the last month. We'll obviously be reporting on it every month in the winter. So I just wanted to highlight that number. That was kind of the biggest one that I thought would be worthwhile. Some other recent reports from the CDC. The CDC is now raising the awareness of the risk of rabies from bats in the U.S. after 3 people, including 1 child, died from rabies between late September and early November 2021. These 3 people had direct contact with bats in and around their homes. None of the 3 individuals received post-exposure prophylaxis shots that can prevent rabies from developing if received before symptoms start. So I'm just bringing before the board that the CDC has now kind of, making sure that we have increased awareness that this is at a slightly higher heightened risk from bats in the U.S. All right, next I'm going to talk to you about a new interesting report that the CDC put out as well. It's a state-level data mapping report for adult physical inactivity prevalence. So this report is a survey-based report. The data is only available at the state level, and it's focused on 5 different race and ethnicities. So first of all, we have the overall data. We have Asian adults, white adults, American Indian, Alaska Native adults, Black adults, and Hispanic adults. Basically, at the state level, the CDC asked through a survey questionnaire whether people had any physical activity outside of their work hours. They collected this data from 2017 to 2020 through a combination of telephone surveys And the report is released. We have data from, again, this is a Massachusetts level data, not a Revere specific data, but I thought it was a pretty interesting report, so I wanted to bring it before the board. If you flip the pages, you can see kind of a map of the United States, but I've highlighted our percentages in Massachusetts. So the first map describes overall physical inactivity. Again, so this is a survey that asks adults, did you have any physical activity in the last month outside of your work hours? 23.3% overall in Massachusetts said no. If you drill down on that data, Asian adults had the lowest had the lowest rate of physical inactivity. So in Massachusetts, among Asian adults, only 17.6% reported physical inactivity over the last month that the data was collected. If we move on to white adults, the number gets a little higher. It's 20.8%. Our American Indian Alaska Native populations reported 17.6% of the population of adults had physical inactivity over the last month that they were surveyed. Our Black population, so our Black adults, 27.2% of them had reported physical inactivity, a complete lack of physical activity outside of work hours. And then the most staggering number that I wanted to bring before the board was our Hispanic population, which we know we have a significant Hispanic population in Revere. 40.2% of that population reported that outside of work hours, they had no physical activity for the last month when they were surveyed. That's a very big discrepancy, obviously. Again, I like to give you all the most updated reports that I get from the CDC to make sure you're informed as I am. And so, again, that is Massachusetts level data. We don't have Revere specific data, but I think it can be pretty well correlated to what we see here in Revere. And then finally, I'm gonna move on to COVID. So I last talked to you at the beginning of December, and wow, we've been on a roller coaster since then. We are actually kind of already coming down from our peak of Omicron. Our total confirmed cases as of January 24th, 2022, is 20,135. Our total deceased to date is 180. Our 7-day case average, this is a huge number, is 103.1. That's a bigger number than really we've ever seen before in Revere, and it's solely attributable to the Omicron surge. Our 14-day positivity rate as of January 24th was 32.7%. Again, that's a huge number. I have good news though. As of yesterday, our positivity rate is already about 10 points less. So we can really see that we're on the downward slope of the wave that we experienced throughout December and January. And with that, I'm gonna move on to a quick PowerPoint presentation of kind of drilling down even more on our COVID data. And then I'm gonna pass it off to Mike Wells, who's going to talk about, because of what we're seeing in COVID, a measure that we want to put before the board in terms of a mask advisory that we want to potentially get around to our businesses in Revere. So I'll let him talk about that, but I'm going to first talk about the data that kind of informed the advisory that we are putting before you all. So if you can put the PowerPoint up again, perfect, thanks. And if you can move to the next slide. Awesome. Okay, so this is a really good visual from the very beginning of the pandemic to about 2 weeks ago is when this latest data. You can see we have a tiny little hill back in March 2020. We have another kind of bigger hill that was last winter, okay? And that was, we experienced a surge last winter just like the rest of the country, just like the rest of Massachusetts, and that was our, before the Omicron wave, that was our highest case level, our highest positivity rate. We really dipped down in June and July, and we had really good case numbers. We had very low positivity, very low, we were doing great in the summer. And then just like the rest of the country, around about August, we started experiencing a rise in cases again. This was around when the Delta variant was coming about, and our case numbers held pretty steady, honestly, until about Thanksgiving time, when you see that our cases skyrocketed. Again, Revere is not immune to the trends we see around the country and around the world, and this is because of the Omicron surge that the rest of the country was experiencing as well. The great news is here, if you follow the orange line, you can see that already we've reached the peak, we think, of the Omicron surge, and we are already on the downtrend. Most experts think that just as quickly as we went up, we are going to as quickly come down, so I hope that holds true here. Obviously, we track this data daily, so we've been continuing to monitor it, and in fact, we have seen a continued decrease in the amount of cases, so that's good news. I'd say, in general, though, our daily case counts are still very high and much higher than we were experiencing back in March 2020 and even back in the surge last winter. So if you can go to the next slide. Okay, a quick vaccination update for all of you, because as you know, along with an increase in cases, we want to always correlate that with what we think is going to help in the future. So here's our vaccination data as of January 18th, 2022. I won't read out the numbers. I think the biggest areas that I want to focus on is our 5 to 11-year-olds. I talked about them last month. We are now at 38% who have had at least one dose and 23% fully vaccinated. So it's a big jump up from where we were at the beginning of December, and we hope those numbers continue to increase. We have regular vaccination clinics for that age group throughout the city. Revere.org/vaccine is where you can find those. And the second thing that I want to highlight with this data is the third column, which talks about percent of our population with a booster. So our next big push from the Board of Health and from the Public Health Department is going to try to get our booster numbers higher than they currently are. We need to make sure everyone who's eligible is getting a booster. So I think we have a lot of work to do there. Overall, we're at 26% of our population who've had a booster, and obviously we need to get that much higher. And so we are going to continue to work on that throughout February. If you can go to the next slide. This is just a graph, another kind of graph that shows the data. This is as of January 4th, so it's a little bit older, but it shows each age group in a different way, kind of the fully vaccinated rate and the booster rate. So our numbers are just even a little bit higher now with the last table I showed you, just a different way to visualize it. If you can go to the next slide. Okay, so this slide is a little bit hard to interpret, but I will try to do my best to walk you through it. We have an epidemiologist who works for Revere and other communities who put this together for us. She compared COVID cases based on vaccination status. The very bottom line is people who are fully vaccinated and boosted. The middle line are people who are only fully vaccinated and have not gotten a booster yet, who are eligible to get a booster. And the very top line, the lightest line, it's like an orange color, are people who are unvaccinated. This graphic clearly shows that if you are fully vaccinated and booster, not only are you at a less of a risk for having severe illness, being hospitalized, and potentially dying from COVID, you are also at less risk for even transmitting and potentially catching COVID. So it's a data-heavy slide, but basically the bottom line shows people who have been boosted and their COVID rates. The top line shows people who are unvaccinated and their COVID rates. You can clearly see that if you are unvaccinated, you have a much greater chance of catching COVID than you do if you are boosted. And you can move to the next slide. So finally, this kind of dovetails with what Mike is going to talk about. I wanted to make sure the board was updated about the landscape of COVID protective measures throughout the surrounding area, where everyone is now and where we are in Revere, and potentially what we can potentially implement moving forward based on your guidance. So right now, I'm going to talk about some of the surrounding communities, what they have. I pulled this data maybe at the end of last week, so it might not be as up to date as, if I looked this morning, but this is what I was getting from last week. So the city of Boston currently has an indoor mask mandate for public spaces. So again, this is a mandate, not an advisory. They put that in September 2021. They also have a vaccine mandate for restaurants, gyms, and entertainment spaces. The vaccine mandate is very similar to New York City's vaccine mandate, and it looks different depending on where you go, but basically vaccination cards have to be shown to enter establishments like restaurants, gyms, and entertainment spaces, and this was implemented in December, so just last month. Chelsea, our neighboring community, does have an indoor mask mandate for public spaces that was implemented in December of 2021. Somerville, again, our other neighbor, they also have an indoor mask mandate for public spaces. This was implemented in August of 2021. Cambridge has an indoor mask mandate for public spaces. It was implemented prior to January 22, but it was updated in January 2022 to include common areas of residential buildings. From what I could research, Winthrop does not currently have a mask mandate. Malden has a mask mandate in municipal buildings only. So then we get to Revere, what we currently have in place. We do currently have a mask mandate in municipal and school buildings that was implemented in the summer. We also have a vaccine requirement that includes a weekly testing option in place for municipal and school employees. So if you are fully vaccinated, you do not have to test weekly, but if you are not fully vaccinated, you do have to test weekly. Again, this is for municipal and school employees. So that's currently what Revere has in place in terms of COVID, I'm gonna say COVID protocols. And I'm gonna pass it over to Mike to talk about the potential mask advisory that we would like to put before you. Again, noting the Omicron surge and just trying to, refresh our businesses, thinking in terms of COVID protocols.
Thanks, Lauren. Tonight, the City of Revere Board of Health is looking to issue a mask advisory for facial coverings in certain public places. Whereas the City of Revere Board of Health, pursuant to Massachusetts General Law, Chapter 111, Sections 95 to 105, seeks to exercise the board's authority to prevent the spread of infectious diseases in the City of Revere. And whereas the coronavirus, as known as COVID-19, is a highly contagious and potentially fatal respiratory disease, the pervasiveness of which has sickened citizens throughout the United States and the Commonwealth of Massachusetts to varying degrees. And whereas the Center for Disease Control has advised that the spread of the disease from person to person is caused by close, within 6 feet, or actual personal contact and through respiratory droplets produced when an infected person coughs or sneezes, and that people potentially can spread the disease even before they experience symptoms. And whereas the incidence of the COVID-19 virus in the City of Revere remains an ongoing concern, and whereas the Center for Disease Control, the United States Surgeon General, the National Institute of Allergy and Infectious Diseases, among other federal and state medical authorities, have recommended that individuals wear a mask or other suitable facial covering to prevent individuals from infecting others. And whereas the board recognizes that covering an individual's nose and mouth can reduce the chance of spreading the virus, as well as reduce the likelihood that an individual will touch their face. Whereas the board recognizes additional measures are necessary to prevent or reduce activities that increase the likelihood of the spread of a highly contagious infectious disease. Now, therefore, the board hereby issues the following advisory. In response to the spread of the Omicron variant, the Revere Board of Health now advises that all residents, regardless of vaccination status, wear a mask or face covering when indoors, not in your home. The Board of Health particularly urges this recommendation if you have a weakened immune system or if you are at increased risk for severe disease because of your age or underlying medical conditions, or if somebody in your household has a weakened immune system, is at an increased risk for severe disease or is unvaccinated. We advise that Revere businesses should consider mask requirements in their establishments during the next several months while we are experiencing a surge in COVID-19 cases. Any business that implements a mask mandate for employees or patrons will have the full support of the Revere Board of Health. We further advise that individuals wear good quality face coverings or masks. When wearing a face covering or mask, it should fit snugly but comfortably against the side of the face, be secured with ties or ear loops, and allow for breathing without restriction. When appropriate, we advise that individuals consider the use of KN95 or N95 masks for increased protection. Please utilize the CDC guidelines at their website, www.cdc.gov, for selecting appropriate masks.
Okay, so that, Mike just read off the advisory that we are putting before the board that we are hoping to implement for businesses once it is voted on.
So you want my vote? You can discuss it. Oh, we can, okay. I'll just say that I think it's a good measure in the fact that a lot of the surrounding communities are having these indoor mask mandates. Obviously, working in the medical realm and working in a clinic, we have masks and are wearing masks when we're at work. We are seeing patients, but I think that there's enough data and evidence to prove that masks do prevent the spread. And in enclosed areas, which often people have to be in and are in close contact with each other, the mask can be a good way to prevent spread.
Sorry, yeah, and just one thing, so this is an advisory, right? So it's not a mandate, but it's a strong encouragement advisory that we hope businesses kind of use the guidance that we're giving them. Again, if voted on, to reconsider their protocols in their businesses, but it is an advisory, not a mandate.
Yeah, I have a question. So if this is an advisory, I know you said the cases are rising, so is it not high enough to make it mandate, or you don't want to go back to the mandate, you want to start advisory and eventually see how the numbers are? And also part of the question, is the advisory, is it just for masking or also for the 6 feet? Because a lot of establishment in Revere, almost everywhere in Revere, they don't do the 6 feet anymore. Most of them, they already peeled the sticker off the floor too and stuff. So I don't know if that's advisory include the 6 feet. And in the future, you guys, where do you see us going with this advisory?
Sure. So this is only for masks. As you know, last summer, I don't know, maybe last even spring, in part of the state's reopening plans, a lot of the protocols around distancing and, number of patrons in an establishment were kind of ended. And so, I think Mike and I, when we think about what is manageable for our businesses in Revere, we want to make sure that we keep in mind that a lot of our small businesses have been very hard hit, and we think that masking is the best method of prevention in a business setting right now, and that we do not need to go back to a 6 feet distancing regulations at this time. It's not really mandated really anywhere. that I know of in the state of Massachusetts, really kind of anywhere those kind of fell off back in last spring. And I think we know a lot more than we did then. And so we know how protective masking itself is, as long as the masks that you're wearing are very, good quality. And, you have to think about too that when you're entering an establishment, you're not necessarily, you're not living there, you're not sleeping there, it's a shortened amount of potential exposure time than you have like in your home or something like that. So I don't think that that's something that we are going to move towards at this time. And I also just want to talk about the difference between the advisory and the mandate, and I'm sure Mike could probably talk a little bit more about it. But again, we need to be cognizant of the fact that at some point we all have to start living with this and normalizing it a little bit more. And so moving back to mandates doesn't feel like the right move for Revere and Revere small businesses and Revere businesses in general at this time. Yeah.
That was a good segue, Lauren, and I can appreciate the fact, right now, there are no COVID protocols in place. When that ended last summer and, the mandates were dropped, everybody kind of went back to our normal life, and as Lauren alluded to, kind of living with this and trying to figure out how to deal with this and move on from it. So it's important to, the advisory, if you guys vote on it tonight, would be in place. As Lauren mentioned, it is not a mandate. We don't have the resources to enforce a mandate. It also puts the businesses in a little bit of a bind when they have uncooperative customers, and it just causes a lot of unnecessary hate and discontent, I guess, in the businesses, and they're already struggling as it is. So we certainly don't want to put them in any more of a bind than what they're already in. So, and again, it's really not, a mandate is really not enforceable to, we can't be out there, morning, noon, and night and be in the mask police. So with that being said, an advisory is doable, see it in the stores when I'm out there, the Targets, the Market Baskets, the Stop and Shops of the world, more people are wearing a mask than not wearing a mask. And, I think at this point, if you want to go to the store and you're not comfortable, then, make sure that you're taking your necessary precautions and wearing a mask.
Are businesses allowed to enforce the mask mandate?
Yes, businesses can enforce a mask requirement
Okay.
at their business, yes.
Yeah, I vote yes for the.
I'll vote yes as well.
And that's going to be 3 yeses. Yeah.
Okay, so I will pass along the advisory for you to sign, and then we'll get it over to the mayor. Thank you. I think that's it. That's it, yeah.
So just a motion to adjourn, Doc?
All right, I think that's it for tonight. I'm going to make a motion to adjourn.
Second?
It's been seconded. Thank you.